Well, let me explain that there's two aspects of our company. One is the biomarkers and the other one is stem cell regeneration, which it comes in two phases. Basically, the biomarkers are what you use for any type of test, whether it be cholesterol or glucose or heart kidney testing. Those are called biomarkers, and we send those to the lab and it determines our overall state of health. Now, stem cell regeneration happens when you actually take stem cells and regenerate the heart, regenerate the pancreas, whatever organ it may be. Now, our two partners, one is Dr. Ann Steele, and she was former chief stem cell scientist at Johns Hopkins Medical University. She actually developed the heart stem cell for heart regeneration. She's also chosen out of all stem cell scientists in the world to be the chief stem cell evaluator for the Singapore government for all stem cells that are proposed or applied in Singapore itself. Our other partner, Dr. Robert Buchek, is one of the foremost pediatric cardiologists in the world. He's on the staff and the board of pediatric cardiology at Johns Hopkins Medical University, at Vanderbilt. Now, those two together have done hundreds of heart transplants. In that process, they discovered how to actually take your own stem cells from your heart and regenerate your heart. And with that, they have determined and discovered how to use your own stem cells for heart regeneration. Now, they could bring that out onto the market at any time and start using it with people and regenerating the hearts, which nobody else in the world has accomplished yet. But they wanted to have some means of being able to prove that their stem cell therapy was working. And that's where the biomarker comes in. We need to develop this kit, the lab is ready to go at the University of Washington, Seattle, FDA approval, clinical studies all ready to go, that these kits, whether it's urine or blood, either one, can be taken to determine the true condition of your heart. There's so many heart tests out there, but they're just not that accurate. You know, many people take these tests and then let's say they go out for a jog and all of a sudden they die from a heart attack. So with the biomarkers, we'll be actually measuring the stem cells that come from the heart which show regeneration or the actual condition of the heart. These are called microRNA exosomes from the stem cells. We've identified those. So now we'll be able to prove when we start doing the stem cell regeneration that the biomarkers will actually gauge and determine not only if it's effective, but the exact amount of stem cells we should use for heart regeneration. Because it's a delicate balance. You don't want too few and not be effective, and you don't want too many where the cells could go haywire. So that's what the biomarkers and the stem cell regeneration, they do together.
How does it actually work?
We have to look at the two aspects of it. There's the biomarkers and the stem cell regeneration. With the stem cell regeneration, that's how we're going to heal the heart, regenerate the heart. There's nothing else in the world that does that. Nobody has accomplished it. With the biomarkers, we will be able to not only determine the actual condition of the state of health of the heart to begin with, but also be able to monitor the treatment. You know, so it's more efficient, more effective, but also we'll know exactly how many stem cells to use. We don't want to use too many and not be effective, and use too much and the cells can go haywire because they don't know what to do with them. So with this process, we'll be not only able to monitor the efficiency and the effectiveness, and that is what's key, because you want to be able to prove that you're regenerating the heart.
What would be the implication of this technology, and how does it affect the health industry?
You know, the implications are very exciting because we have the potential to change the whole paradigm of medicine as we know it today in many levels. First it will be the heart, then we'll work on other organs. The implications is not only will we be able to have effective treatment for the heart, there's no drug now that reverses any disease. You know, they can slow down the process and they can suppress the symptoms. Nothing reverses and even possibly cures dis-ease. And one of those is the heart condition, heart degeneration. With stem cells, they are regeneration. There's still a lot needs to be discovered and a lot needs to be proven. And that's the implications of what we're doing with the biomarker and the stem cell regeneration, is we will be able to prove the effectiveness. Now, how that will affect the whole industry is now people spend millions and millions of dollars with heart surgery, with heart treatment and with drugs and such. What we want to do is to make a more affordable stem cell approach that will initially help the heart regenerate and reverse cardiovascular disease of all types. And then from there, we will branch out and go into the other organs and prove that we can regenerate every part of the human body. So what that will do will save individuals let's say the suffering and the catastrophic financial devastation that can happen from one surgery, one stent, one transplant, whatever it may be with open heart surgery. We will be able to not only prevent that, which would be wonderful in itself, but also offer treatments that are much more affordable, which will not devastate somebody's whole family, their life savings, and the economy of countries as well. Because, right now the countries around the world spend billions and billions of dollars in heart care. Cardiovascular disease is the #1 killer of human beings on this planet today. So that's where we'll start.
Could you tell us a bit more about the current stem cell market?
Sure. Stem cells today are mostly not affordable for the majority of people on this planet. One thing we want to do is to create an opportunity for more people to have availability and access to stem cells. That's one of our primary objectives. Now, the stem cell market has grown exponentially. It's gone from $1 million industry in the early 2000s, and now it's a multi-billion-dollar industry. And a lot of it's not effective, and that's the key too. And with our researchers, Dr. Ann Steele and Dr. Buchek, their whole purpose and intent is to provide stem cells that are truly effective, but also affordable. So that's our main objective. Now, we have to realize too that with these biomarkers, the market is unlimited. Right now, people pay billions to even trillions of dollars in heart laboratory tests. There's a whole range of them, and that is it's such a huge market. We will be able to revolutionize that and transform it and make this kit available in a very affordable cost, so people will be able to determine exactly the condition of their heart initially, and then the other organs. Now, the market for that is just completely unlimited worldwide. So we're talking about billions of dollars just for the kit alone. And then when we expand into the other organs, that is just going to grow even more, because there's a demand for it, and we want to meet that demand and also make it affordable to people.
And the last question, how would you develop your biomarker technology and stem cell regeneration further?
One thing that everybody needs to realize is this has the potential to change the whole paradigm of medicine today. Instead of having drugs that are given to people for various diseases, we will be able to activate your stem cells. Now, understand, in your body, you've got billions of stem cells that are dormant. They're sleeping because they're not getting the food they need to be active, to do their job. Not only do we have stem cells in a bottle, which is all natural, or we'll be feeding your stem cells to awaken those, but with these biomarkers, we'll be able to monitor every disease eventually that an individual, a human being has, whether it's diabetes, cardiovascular disease, Alzheimer's, kidney disease, liver disease. Monitor it, see its condition, and then be able to activate your existing stem cells in your body to go where they need to go, which is called homing, and do what they need to do the action. Now, with that too, we will be able to monitor drugs, prescription drugs, to see if they're working, but also be able to direct them where they need to go to be more effective. That's a whole nother level. So initially, after development of the of the cardiac or the heart stem cells and the biomarkers. Then the biomarker will expand where that kit will also be able to determine the actual condition of health of your pancreas, diabetes, of your liver. There's so many liver disease today, and even of the brain. Alzheimer's is coming earlier and earlier to people. And every condition that exists, whether it be kidney or the eyes, we'll be able to regenerate every part of the body by activating the stem cells within you, giving them the message. It's kind of like a programming through what's called the microRNA, the cells themselves, which are the messengers, to go where they need to go, to heal that part of the body. And even the skin, will be able to use it for aesthetic purposes, which would be wonderful too. So it's going to be a total holistic, whole body, whole mind approach to regeneration.